Hello. So Ann and I recently went to a conference. We went to CALM in Fort Lauderdale, which stands for Clinically Applied Longevity Medicine. And we learned so many things. So I thought it would be fun for us to just tell you the top 3, or maybe in my case 4 or 5 things that I learned and love and have already brought back and started using. So the first one that I learned was about genomics, and I've done these before. I've done them on myself and I've done them on my family, and literally the results were life-changing. But the ability that we would have to deliver personalized medicine was just, it was a good reminder that this test is really important. So I'm really glad that we're able to offer that again here. The next one was probably Dr. Abid's talk about cardiovascular markers. We can use basic labs that typically your insurance pays for and use a bunch of different methods to stratify your risk and let you know what you can really alter to change your lifespan and, more importantly, your health span for a good quality of life. And then, of course, Dr. Yurth, Betsy's talk on supplements. Anytime I'm in a room with Betsy, I just automatically feel smarter, so her talk was amazing. And then probably the last most impactful thing was about COVID, learning how to treat long COVID, and even more importantly, I felt, is to prevent long COVID, which actually came into play this past week as somebody very near and dear to me became sick with COVID. I know what to do to prevent her from having issues long term. So those are my top few things. So what were yours?
I want to piggyback on yours, because what I really love is not just getting the knowledge and loving the speeches, or not speeches, but the talks, like Dr. Abid's, we've already put into practice. We already have patients whose labs we've looked at. We're already using the knowledge we've gained. So I think that's phenomenal, because everything that they've taught us is just so easy to put into practice and to bring into what we're doing here as far as health and wellness. Also loved Betsy, your talk. I mean, she's so easy to listen to and just so knowledgeable and makes everything so relatable to every patient that we see. Another one that I really loved had to do, of course, I keep talking about it. It was Cynthia's talk on the tryptophans and long COVID, and how, you know, the long COVID or COVID just steals things from different organs and different systems, and it leaves us deficient in tryptophan. And you've probably heard it before, where we're talking about tryptophan in turkey, right? Thanksgiving, it makes us tired, it makes us sleepy, all of that. But there are so many health benefits to the use of tryptophan, especially in affecting someone's mood or affecting, you know, just their whole bodily systems, especially post-COVID. Like when you're dealing with long COVID, which I dealt with for years, and the brain fog and everything, and how horrible I felt. Like, had I known, or had it been around then, to supplement tryptophan, like, I just can't even imagine. Just the results are astounding, and it's something, it's so well received that we can't even get our hands on it right now. It's on back order. So it's definitely something I think we will be incorporating into our practice. The other thing is someone we know and love, Chris Wusterhausen, his talk on the AMPK activators, something that helps with the weight loss and energy, and just creating more mitochondria in our cells, and just the workhorse, our energy cells, all of that, and bringing those in and about, and incorporating that into weight loss programs as an oral supplementation as opposed to an injectable. And we're hoping to see that this summer.
Yes, so lots of great things. That was just really a tiny bit of what we learned over 3 very long, packed information days.
Yes.
So if you feel like any of that might interest you or a loved one, please feel free to come by and see us.
See you soon.
Have a good day.